know what we're all about? It's like this, y'all, come on. This is 10% power, 20% skill, 15% knowledge, whether liquid or pills, 5% swagger, 15% in, and 100% reason to remember the name. Got the science and compliance, now we form the alliance. Hold the key to the future, let the past fall behind you. Innovate, upgrade, then reboot the flow. Now the new platform is SB 2.0. That's selling with a purpose.
There are great opportunities for the representatives to be able to go out there and educate their clinicians about the use of this medication, which can make such a huge difference to patients.
And it doesn't stop there. On May 15th, Doctors Michael Thorpe and Richard Bogan will host the first ever live national broadcast event for Xyrem.
I'm excited to have the opportunity to be able to present Xyrem with Dr. Bogan in this broadcast. There's a lot of new information to be able to say about the disease state as well as about the Xyrem.
This event, titled Management of EDS and/or Cataplexy in Narcolepsy, will be broadcast simultaneously to select locations all over the country. Xyrem. Opportunity lies ahead. Are you ready?
The Exalgo REMS Healthcare Professional Education Program Kit includes resources healthcare professionals need to ensure responsible prescribing and use of Exalgo. Inside the left pocket of the folder, you will find a Dear Healthcare Professional letter, the Exalgo full prescribing information, and the Exalgo medication guide. Healthcare professionals should read these documents before prescribing Exalgo. Inside the right pocket of the folder, you will find the Exalgo prescribing brochure and the Exalgo essential information form. These two documents are particularly important to ensuring the safe prescribing and use of Exalgo. The prescribing brochure discusses the primary risks and risk factors associated with general opioid and Exalgo use.
Fibromyalgia can be a clinically challenging disorder to diagnose and treat. It can mimic the symptoms of other disorders and is comorbid with other medical conditions. Patients who've often endured their symptoms for several years can be frustrated, adding to the challenge for healthcare professionals. In the case you're about to see, Jennifer, a 44-year-old female, has been dealing with pain for several years. It's been getting progressively worse.
I mean, one day I was fine. Then I started getting these headaches, and I wasn't sleeping too well either. And when my whole body started to ache, I was like, geez. So I took some ibuprofen. When the ibuprofen became a regular thing, I saw my doctor, but he couldn't find anything wrong. It really started affecting my mood. My husband started to notice that I was more irritable, and I tried to explain that I was in constant pain, but it's hard for him to understand because I look normal.
Jennifer, based on my diagnosis, I think that we should switch your current SSRI to duloxetine, which is an SNRI, and that'll treat both your pain and your depression. And the switch can be done very quickly, so you can start to experience relief in your symptoms soon.
That's great. What about side effects?
That's a good question. The side effects of duloxetine include
We've got children who are becoming addicted because of that which has been diverted from legitimate pain patients, and we have many of our patients who are misusing and overusing their medications.
Unfortunately, the problem of opioid abuse, misuse, diversion is huge in our society. Anyone who reads the papers understands that prescription drug abuse is a challenge that we need to meet.
This is a tragedy of major proportions.
On behalf of Covidien, I invite you to learn more about these approaches during a national broadcast event titled Important Considerations in Customizing Pain Management, Patient Selection and Dosing Strategies. Joining me on the faculty panel will be Dr. Charles Argoff, Professor of Neurology at Albany Medical College and Director of the Comprehensive Pain Center at Albany Medical Center, as well as Dr. Joseph Sherman, Chair of Pain Management.
I urge you to think about it in the following way. It's a concern that we all have. It's a responsibility that we share. It's a cause that we all can champion.
The future is in our hands. We control our own destiny, and CARES Alliance is an important aspect of how we reach that destiny.
RD is a 38-year-old male who's coming into your pharmacy with an opioid prescription. He's an established patient, but you perform a pharmaceutical care assessment, high volume, since his last risk assessment was 6 months ago. He has 3 negative risk factors, scoring 8 points. He has 0 positive risk factors, scoring 0 points, so his total points are 8. RD would be considered medium risk. Recommended strategies would be to provide special care with every interaction. Be thorough in addressing each step of the vigil process with the
people, products, performance, we on it. Specialty pharmaceuticals is what we come in armed with.
Great, love it. Money. New messages are right on target.
It's really going to enable us to get some good market share gains.
Understanding why science informs clinical choice with the data that enables a clinical decision. Covidien sums it up by selling with precision.
We're going to have a lot of fun. I think we're going to take names and kick butts.
We want majority share, so here to run this block.
It's going to really make an impact on our physicians and their patients.
SP 2.0. 10% power, 20% flair, 15% thirst for 95% share, 5% swagger, 15% and 100% reason to remember the name.